As a psychiatrist, how did you become involved in treating cancer?
Well, it happened by accident. In 1960, we were then we were working with the mole factor, this particular marker of oxidative stress, the mole factor, which we found in the majority of patients. And we wanted to find out how often it appeared in people who were physically stressed. And so we found that it was also present in a high proportion of cancer cases. I was working at the University Hospital in Saskatoon, so I had access to all the wards of the hospital. In 1960, there was an old gentleman who was a very famous professor, a researcher. He had developed cancer of the lung. They diagnosed him, they treated him with cobalt bomb radiation. He became psychotic, and therefore he was admitted to our ward at the University Hospital. And because he had both cancer and was psychotic, I became very interested, and we got a sample of his urine, and he had a huge quantity of this particular mole factor. And so I arranged that he would be started on niacin, because my experience had been that if you had that factor, you responded very well to niacin and vitamin C. So I started him on niacin and vitamin C on a Friday, and Monday morning he was mentally normal. Now, I wasn't treating his cancer, I was treating his psychiatric condition. And so on Monday morning when he was normal, I spoke to him and I said, look, I said, I will give you, I was the only doctor in Canada in 1960 who had 500 milligram tablets of niacin and vitamin C that were made specially to order for us. The largest ones you could buy in a drugstore were 100 milligrams, and they were too full of junk, filler, so that they would make people sick if you took too many. So I said, if you come to my office once a month, I'll give you free these 2 vitamins. So he said, okay, great. I didn't think he would last long. After all, he was terminal. The cancer clinic had said he's going to be dead within a month. Anyway, he kept coming, and after a year he was still coming. And so I had lunch with the head of the cancer clinic, who was a friend of mine. I said, what's wrong with this guy? How come he's still alive? He said, well, we've taken an X-ray of his lung every 3 months. He said, the tumor's all gone. He lived 28 months altogether, and he was old. He was about 76, 77 when he died. I don't know what he died of, because I had hoped that he would die at our hospital, and then we would do an autopsy. But he died at a different hospital, and there they buried him before I even knew he was dead. Because I would have loved to see his lung to see what had happened to that tumor. So that started me thinking, one case doesn't prove anything. But one case is like looking at one white crow. How many white crows have you seen?
White?
Crows. A crow, a bird?
None.
None. But if you saw one, and so the rule is crows are all black, is that right? But if you saw one white crow, you'd say the rule's wrong. I've just seen a white crow. I had just seen a guy who was terminal with lung cancer who had recovered on vitamins. So this was like looking at the white crow in a population of black crows. So that always stayed in my mind. I thought it was the niacin, not the vitamin C. And then Cameron Pauling published, and I read his work very carefully. I said, oh my God, it must have been the vitamin C, not the niacin. Then I moved here.